Hey, I'm Sue with MageeNews.com and have with me today Melanie Scarborough, who is a nurse practitioner at the Magee Walk-In After Hours Clinic. We have been talking about some different things that are now available at the clinic, and I wanted Melanie to give us a little more detail on pediatrics because I do know that Dr. Smith has left.
Yes, ma'am.
And we don't have a pediatrician. So what are these people? For now. Okay. We don't have a
actively recruiting for pediatric services to be covered again. In the meantime, Martha Smith is available for pediatric patients. All of our other physicians accept pediatric patients. And of course, I love the pediatric population.
Oh,
and we can serve your needs for your children in the after-hour and walk-in clinic.
So y'all are, so if I have a baby and it gets sick, we're fine to go in
Yes, ma'am.
your clinic.
Yes, ma'am. Now, some of the other providers are not as comfortable with newborns as the others of us. We're about half and half on that. And so some of them might tell you, well, that's a little too young. I am fine with 2 weeks and up. Martha is very comfortable in her clinic with 2 weeks and up. April is comfortable. You just kind of have to, it's at the discretion of the provider with their comfort level.
Well, what about with, I always took my children to the pediatrician to get their vaccines. So what's going to happen now with vaccines?
Eventually, now Martha has a full line of vaccines available. The health department has always had them too. You can get them there. They're the same vaccines, they're the same quality, the same manufacturers, they're all the same. And we will eventually, we are preparing now to have our stock of vaccines put in. It's just a process we have to go through.
So eventually, you can just get your vaccine over there too, and you don't have to go sit.
Exactly.
Oh, that's going to be great. That is going to be
You can
great.
have well baby checkups. We probably, a lot of new mothers are used to the what we call EPSD screenings that the babies get the newborns get every 2 months. Now Martha will continue to be the primary provider of those EPSDT screenings, but we will provide everything else, including the vaccines.
That is going to be great.
It's great.
It's such a time saver, really, for everybody.
Exactly.
For everybody, because you're going to have some people that they're not leaving their doctor. I'm sorry.
That's
They've
right.
been when they're old. They're old like me. They don't want to particularly leave their doctor, but that's not always true. I am more open to it, but I do understand if you've been using the same doctor for that many years, you're not going to want to change.
You've bonded and developed that relationship.
It's going to make a difference. I think this is going to be great, and I'm so glad that because isn't there a new vaccine we have to get?
The 7th grade
For somebody?
children are required this year, prior to starting the 7th grade, they must have proof that they have received the DTaP vaccination.
What's that?
And that's the diphtheria, tetanus, and pertussis combination vaccine that the CDC, it's been offered for several years now, and the CDC has made it a requirement for all 7th grade children. Now, if you've already in the 7th grade or past the 7th grade, then you do not have to have proof that you've had it. But from those younger coming into the 7th grade, from here on, they will have to have proof that they have been vaccinated.
See, and I always think of vaccines as just young children.
Well, eventually that will
It will evolve back to that.
Is that the word for it?
Well, all right. Let's say a child who is in the 8th grade now. Do you advise someone to go to get that shot?
Absolutely.
Even if you're 8 through 12 or whatever, go back and get this shot.
It's always just been a recommended vaccination in the past, but like I said, now the CDC, through research and data collection, they've proven.
What's it supposed to do?
It protects us from diphtheria, tetanus, and pertussis. And pertussis in particular is making a comeback in the United States.
What is that?
Whooping cough.
Oh.
And when you have a child, we give these vaccines when they're young. Okay? You think of baby shots, like you were thinking of, but they need to be boosted at the age of 12. But those are not required. You don't have to have any proof that you've received those to continue to enroll in school. So now they're saying, okay, we want proof that you've had this, because pertussis has made such a comeback in the population, and it's infecting our children and our older people. We're all living more communally now. You may have several generations in the house.
That's right.
And if the little baby gets it, it will just about kill them. And then the older children bring it home to them from school, and it's just a domino.
Oh, it's just a vicious
very,
circle.
very dangerous. Very dangerous. to a young child, especially,
That's
and
scary.
an older person.
Right.
So they have made it mandatory, and it's the only one right now that is mandatory. You know, you get your ones to get in school, and then you don't ever.
Do not forget about it.
Exactly.
I mean, I got you in school.
There's nothing else you have to prove until now.
How does everybody know this? I mean, I don't have a child going to the 7th grade. I don't have a young child. So how is the word being spread? Is it through the school
media
systems?
and the media.
And they're told
it's
that
in the newspapers. The health department has literature that they have available. It's been on the news. I've heard it on the news. I think the health department just had their annual free vaccine clinic a couple of weeks ago.
They did.
And
Because we promoted that.
Good. And you, Miss Sue.
Yes.
See?
I just didn't know I was giving a 7th grader a shot. I just know that we always promote those vaccines.
Exactly.
That, you know.
They're
So
very
do you
important.
think you don't have any idea when y'all will be stocked with vaccines?
I would say I know that it's not gonna be in time for school.
That's what I
know,
wonder.
but I'm hoping we have flu shots.
Oh, yeah, that'd be great.
It's a process you go through. You know, I've got to set up my refrigerator. I've got to pass state inspection. I've got to have so many logs of temperature control. It's a lot of steps to.
You just don't take the little bottle across the street and poke it in their
I think
arm.
I'll give these.
This one look good. Get these all the way.
No, it's a process with the health department to become a vaccines provider.
It's so interesting to look how our medical community in Magee grows. I think when people talk to me about anything with Magee, I always say we're one of the best medical communities you can live in. Thank you for watching Magee News, and I hope you will get your vaccine.